an educational product of the International Society for Bipolar Disorders, leading the way in research into the diagnosis and treatment of bipolar disorder.
I knew I had problems.
I knew something wasn't quite right. When I had already become a senior executive, my behavior was bizarre, to say the least, on the job.
It whacks you different ways at different times.
So I was probably sleeping 4 hours a day.
I was really looking for something to stabilize me.
You say things you don't mean, and you get yourself into situations, and then afterwards you're like, oh my gosh, what am I doing?
Basically racing ideas. And then you hit a point where you realize to you that you can't tell what's real and what's not real anymore.
Bipolar disorder is a common mood disorder that affects mood, energy, thinking, behavior, and often impairs judgment.
Bipolar disorder is a condition that affects approximately 5% of the population. It's a type of mood disorder where patients experience manic as well as depressive episodes. We try to make sure that people that have the bipolar disorder understand that it is a disorder of the brain. It is a medical illness. They have this illness not because of what they did. It's not their fault.
Bipolar disorder has several subtypes. These are bipolar 1 and bipolar 2 disorder and bipolar spectrum disorders. Those that have experienced at least one manic episode are diagnosed as having bipolar 1 disorder. An episode of hypomania and an episode of depression are required for a diagnosis of bipolar 2 disorder, while those with hypomania, mild depression, and other characteristics are diagnosed as having bipolar spectrum disorders.
If you look into the real world, there is a continuum. So some people have one or two symptoms, some people completely fulfill all criteria for what we call a manic episode or a depressive episode. The definition, when to call it a bipolar disorder or not, also depends on this degree and the number of symptoms you have.
During manic episodes, a person often feels happy or irritable for no reason, has tons of energy, and feels less need for sleep. If untreated, manic episodes can last 3 to 6 months.
Well, during the highs, you get lots of energy. You're outgoing, you're extroverted, talkative, life of the party. It's like being on a little bit of speed. You do things you wouldn't normally do. You get impulsive. You can do things that involve risk that are out of character for you. You can really get in a lot of trouble during an episode of mania.
Your fears melt away. Your inhibitions, they just vanish.
Your senses are on overdrive, you feel everything much more in a heightened way, I guess.
It seems like you get overwhelmed and you lose your judgment. And I started to make collage. I covered the walls in the entire house with my collage.
You have a lot of really, really great ideas, and they come really quickly, and you think they're the best possible ideas, and absolutely everyone has to hear them. And for a while, seem like they make sense to you. They don't necessarily make sense to other people. And then you hit a point where you realize to you that you can't tell what's real and what's not real anymore, and that's what's kind of the terrifying thing.
The crazy things are great, That's hard to give up.
When she was manic, it was kind of exciting. I mean, it's almost like watching a circus. She could do 5 things at once and be charming throughout them all.
Depressive episodes are often debilitating for people, as they have little or no energy or motivation. Depressive episodes are difficult to treat and may last several months if not treated appropriately.
During episodes of depression, people can feel flat, lethargic, they'll be slowed up, they'll lose interest in things, they lack motivation, drive, and energy. Their appetite can change, and their concentration and attention spans are impaired.
The illness had really begun when I was a teenager, and I can think of certain instances where particularly I was comatose, sleeping all the time. I remember at the time being told by my parents that I was lazy.
The weather last winter was just like, I felt it like an injury. It was just like all the rain and the wind we had here and the snow and the cold. It was just like, it was almost like personal. Like it's just like hammered me down. I couldn't get out of it.
A mixed state is when a person has the symptoms of both mania and depression at the same time. They suffer from irritability, negative thoughts, and anxiety.
This is the phase of illness where people want to kill themselves the most. During this phase of illness, people feel depressed, but at the same time, they're activated, they're hyper, they're restless, and they think a lot about suicide.
While the cause of bipolar disorder is not completely understood, a combination of genes and environment are thought to be the cause of the illness.
Currently, it's supposed that about 10-15 genes in combination can contribute to what we then call the genetic vulnerability, but not everyone with the genetic vulnerability get the illness. Environmental factors contribute to whether or not the illness will be expressed, and we have shown, for instance, that serious life events in combination with this genetic vulnerability contribute to the development of the first or the next episodes.
We believe that these genes turn on or change some of the chemical pathways in the brain that might eventually lead to symptoms of depression and mania.
Other aggravating factors are things like drug and alcohol use, particularly amphetamines and cocaine, marijuana. But it's also true that in many instances, bipolar disorder can begin without a very clear trigger, sort of a lightning bolt out of a clear blue sky.
Bipolar disorder cannot be diagnosed by a medical test. The diagnosis is made after an assessment by a trained clinician and may include a psychiatric, medical, and family history.
So bipolar disorder is a collection of symptoms, and when psychiatrists meet with patients, they ask all these symptoms. Now here's the problem. They'll almost always ask about depression. Neglect to ask about the symptoms of highs, well, they're going to miss the diagnosis.
Misdiagnosis is quite common in patients with bipolar disorder. If somebody is in a manic episode, they don't necessarily seek help. When they seek help for depression, and of course end up getting the wrong treatment, it may switch patients into a manic or hypomanic episode. If you prescribe an antidepressant to a person with a bipolar depression, thinking that they have unipolar depression, that destabilizes the course of bipolar disorder.
Most of the people develop the first signs of bipolar disorder just immediately after adolescence, between 15 and 25 years of age. Although it can happen for the first time in old age, and it's being recognized in very early childhood.
So in the majority of instances when people have this illness, when it presents during youth and young adulthood, they go on to have this illness, not diagnosed and treated, for somewhere between 8 and 12 years. So that's really important, because during those years, that's when the illness gets a mind of its own, and that's when people turn to alcohol and drug use as a method of self-treatment.
When somebody goes to see a physician with some mood symptoms and with a history of drinking too much alcohol or taking some of the substances, there's a tendency for physicians to somehow think that this was related to abuse of substances rather than a mood disorder itself.
I don't think they diagnosed me right. They never treated me as a bipolar patient. They didn't give me the right drugs for that. I know that now. It took them a while to find the right medication, one that would get me out of depression, but that wouldn't push me into mania.